Hello, my name is Jared Lara, and today the topic that I chose to tackle was I believe that there should be access to abortion, that women should have the right to their own reproductive system, and as well as we should be teaching these kids in school about sexual education. Now, why are all these topics important, right? Now, I believe access to abortion is important only because I believe that a person has a right to their own body and to choose to do with what is in their body, right? Whether that being a fetus or some kind of person being inside their body, right? Um, Same thing with the reproductive rights. I believe that no one should be told on how they should live their life and what they should and shouldn't do with their own body. That including both men and women. If a woman would like to get an IUD or any type of contraceptive, I believe she has the right to do that. Same thing with men. In terms of vasectomies, I believe a man should get a vasectomy and there should be no law taking away from that. But that is besides, right? Gender is not part of the bigger conversation, right? As well as access to abortion is important as it encourages women to seek safe abortions instead of seeking, a less safe way in terms of what happens to their body. We hear a lot of the time that when a woman isn't able to get safe access to abortion that she goes to other methods, so anything out of clinic abortions, anything to a even backyard abortion, meaning that there is someone running an abortion clinic out of their own house with none of these sanitary uh, guidelines that hospitals follow or any clinics follow, right? I also believe that the reason we should learn more about sexual education is that it provides a more accurate information about our self bodily autonomy, contraception, STIs, consent, and a healthy relationship with our own bodies, right? I believe that the the fact that we do not teach it so heavily in schools is a bad thing, as you have a high rate of teen pregnancies, as they don't understand the process of what it is to be pregnant, specifically being girl, women, or however the person may identify. But if they are able to get pregnant, they're not understanding the amount of toll that it does take on one's body. That being that the person or the baby that is growing inside of you, the fetus that is growing inside of you, the cell that is growing inside of you, takes a lot of energy and nutrients out of the person. So a lot of people don't really take that into account, as well as open access to abortion, reproductive care, and sexual education does help break the stigma and create a culture where people can feel safe to ask questions, seek help when needed, and make informed choices. We don't want people out there in Texas, or I don't want people out there in Texas, being scared to make a decision about their own body because they are afraid that they will get locked up, that people will have some kind of social stigma against them. I know people in my personal life that have gotten abortions, have gone out of state to get these abortions, and the fact that they do that is because they know bringing a child into this world may not only end up with them in poverty, but with that child also in poverty, right? So the less amount of children that we can have, out of poverty, the better, in my opinion. Now, here on the right side of the screen, you will see a figure by a what is it by a research done by an institute. So here you can see that the monthly differences in numbers observed versus expected births in Texas drastically increased from January 2016 to December 22. Right here you can see a small explanation stating that a horizontal line at 0 indicates no difference between the observed and expected number of monthly births. Dotted vertical line in March 2022, as you can see over there to the right hand of the graph, was corresponds to the last birth cohort not exposed to Texas Senate Bill 8 that was used to generate the exposure period counterfactual. Shading indicates that 95% CI in the policy exposure period, right? This just states that we are seeing a wider or a larger amount of people that are supposed to have expected births versus the observed births, right? Um, Right, on to the next thing. Some challenges and problems that have occurred here in Texas. Right, we've had a near total abortion ban. Senate Bill 8 and subsequent laws in Texas have effectively banned nearly all abortions, even in some cases of rape or incest. Right, these laws ban abortions after about 6 weeks of pregnancy, often before many people even know they're pregnant. Right, the most of the time people know they're pregnant either through sicknesses, but some people do just constantly are always nauseous. I know some women in my life personally always just have a feeling of nausea, always just have this feeling of sickness, morning sickness, right, which may be a greater health issue uh within that person. But a lot of these symptoms do overlap with early stage pregnancy to as well as just health issues that a lot of women face within their early years. Now, you know, it also allows private citizens to sue anyone who aids or abets an abortion, creating fear of legal risk of being illegally going against the laws that are put in place here into Texas, right? So getting an abortion any week after 6 weeks is illegal here in the state of Texas. Like I had mentioned, Senate Bill 8 does nearly ban all abortions here in Texas, that causing people to travel out of state to seek a safe abortion. Even then, it is not guaranteed that when they land back in the state that they are safe from legal persecution due to the bills, right? We did have a couple of points brought up, or a couple of laws trying to be brought up within the past 2 years, stating that even if you state that you are pregnant or have been medically deemed as pregnant, that traveling outside of state to have an abortion can be legal. We did see some of that in the news. I'm not too sure. I did not do too much research on that, but there is a big possibility that could happen in the future. Now, we also not teaching the proper sexual education within our school system, creates a lack of comprehensiveness in your sexual education. So it does not require public schools to teach medically accurate or inclusive sexual education. It often emphasizes abstinence only approaches, so not having sex at all. It usually teaches kids to not have sex as the dangers of STDs and all these other sexually transmitted diseases, when we should be teaching kids that if they do have sex, as we know there is a high percentage of teen sexual encounters through personal and through different experiences. I can attest to the statement. um, a lot of these programs do exclude LGBTQ plus topics and limit discussion on contraceptive and STI prevention. I think the most that you see is teaching people how to put on a condom, or teaching males how to put on a condom. Now, I feel there should be more sexual education taught, as if there is a bigger emphasis on teaching kids on how to properly and safely have sex at the young age of 16 or even 15 at times, we can lower the STI rates and teen pregnancy births all together effectively, in my opinion, lowering abortions and anything of that sort. And finally, limited access to contraceptive and reproductive healthcare have been in place here. So that is one of the big challenges. Texas does have one of the highest rates of uninsured people in the U.S., especially among low-income women and communities of color, right? Causing women of color and uninsured people to not um, seek out medical attention within their birth cycle, right? Whether they're having complications within their birth cycle, or they're seeing unnatural bleeding or anything like that, right? It causes women not to, because they'd rather take on this physical toll on their body rather than a financial toll on themselves, right? Because it is a lot harder to come out of a financial toll in most cases than it is to come out of a physical toll, right? In 2011, the state did cut funding for family planning by two-thirds, causing dozens of clinics throughout the state themselves to close, right? Causing longer wait lines, longer waits within having to get seen by a professional within the sex within the sexual orientation clinics, I guess, right? And many people do live in rural areas here in Texas. There has been a big study linking rural area people living in rural areas to Medicaid, and they often do struggle to access basic reproductive care like birth control or even pap smears, right? Now, some of these issues and what we can do to attempt to solve these problems, right? First of all, we could advocate for policy changes, whether that being in our local government or in our state government. um we can repeal or revise restrictive laws like the SB8 bill that ban abortions and criminalize providers, right? We can push for legislations that protect reproductive freedom within our communities and within our state itself, including abortion access, contraceptive access, and healthcare privacy, right? Separating government from healthcare, right? Not allowing the government to see what is going on with our bodies. That is such a big, in my opinion, that is such a big invasion of privacy within the private citizens. Um, and also support candidates and elected officials who prioritize these reproductive justices and science-based policy. We do want to push for more of that. We saw Beto O'Rourke and Colin, I cannot remember his name at the moment, but we saw them push for abortion access, reproductive access, and reproductive care within their campaigns. Sadly, we did not get them as our candidates or as our elected officials, and instead we did have other people in power who do not care as much or believe in the opposite, right? We also can increase access to reproductive health care, expanding Medicaid eligibility and fund reproductive health clinics, especially in underserved rural areas here in Texas. As I had stated before, there are a ton of rural areas here in Texas, most urban areas being the bigger cities like San Antonio, Austin, Dallas, and Houston. And we can also restore funding to organizations like Planned Parenthood and community clinics that are able to provide birth control, cancer screenings, STI testings, and prenatal care, right? If a woman does decide to go through with the pregnancy, we would rather have them seen more often and have access to prenatal care, as it'll help the birth go a lot easier and help diagnose any diagnose any uh, problems with the pregnancy, right? Um, and then finally, we should support legal and financial resources for those in need. So, funding abortion funds and travel assistance programs for Texans who need to seek care out of state. We do have a lot of nonprofit organizations that you can find online that are Texas based and some aren't, that will help you get to the out of state clinics. But I wish there was a bigger emphasis on it, as the only way to find these things is if you actively seek out and are not, it's not just something that you already know about, that someone should know about, right? Also offer legal aid for healthcare providers and patients facing lawsuits or harassment from the Texas government or from any Texas official here. And create mutual aid networks and confidential hotlines for people in crisis, right? Now, criticisms these solutions may pose. Some people do claim that abortion is morally wrong, whether it being religiously or just through moral ethics. Some people do believe that a fetus is considered a full person, um, and that they should not be aborted. Right now, um, there's also other criticisms stating that taxpayer money shouldn't fund abortion or birth control. But like how I said earlier, one way we could take this criticism is, one way we can solve this criticism is, not funding it through taxpayer money, but the actual, I guess, the government, or there being government agencies or government programs that are in place, that don't take away from the taxpayers' money, that do fund these things, right? There's other people that states this is culture or a political agenda, right? Which can, it is proven that it is a cultural or political agenda, as some cultures do not believe in abortions, and so do one side of the political spectrum do not believe in abortions, and then that these changes go too fast or ignore community values as a total, right? So you would see some people say that this can go against the community values here, in certain communities here in Texas, as some communities are very Catholic, very religious based, as well as very politically based, right? Now, how would we respond to such criticisms, or how would I respond to such criticisms? One thing I would state is, if you were there and this was your own daughter, is this was your own wife, having problems medically being safe to have a child, right? How would you feel if you're on that side now, right? How would people feel if this is someone close? Because it's always a bigger issue when it's something that hits you more personally, right? The biggest argument that I can give is, do not wish upon others as you would not wish upon yourself, right? Uh, there's some religious texts that I can get into as well, but realistically, there's a saying that says, do not wish upon others which you would not wish upon yourself, right? So one thing is, you, God forbid, or for hopefully the person that I would talk to hypothetically, has a wife or has some kind of person in their life that is a woman that was going through some kind of pregnancy, if they are pregnant at the time, right? One thing I could give them in perspective is, what if your wife or your daughter or your cousin or whoever it is does need abortion access because the pregnancy is going to take the life of that person? How would they feel, right? Would you rather choose someone that is, I guess, unborn or stuff like that, the then risk the life of the mother um that is coming in, and so, finally, what information would it take to change my opinion, right? I don't think there is any information that can change my opinion. I am very pro abortion access, pro sexual information. At the end of the day, I feel like I wouldn't want someone to say what I can and cannot do with my body. Same way I do not wish that upon others. I don't wish, I wish we lived in a time where women weren't told what to do with their bodies or what they could and couldn't do with their bodies, right? Especially the government peeking into their own healthcare, right? That doesn't only go against them, but that goes against almost, I think, against everybody's belief. Why would you want someone else knowing your well-being, your health, other than your family or those people close to you, right? Knowing what you're doing with your body, it's your body, your choice at the end of the day. I think there is no way for people to change my mind on this subject. I don't think my mind could be changed on this opinion. I'm very heavily stuck, and thank you for listening to me talk about why I am all for these things. Thank you.